The importance of sleep. It's been stated that if sleep doesn't serve some vital function, it's the biggest mistake that evolution ever made. In fact, I've heard some commentators say that perhaps it is the most important function that has been conserved over millions of years of evolution. We know that an important lens into occupational health can be provided through sleep. Well, there is a master circadian clock that is situated in the brain in an area called the hypothalamus, and specifically we call it the SCN, the suprachiasmatic nuclei. This master clock controls a number of physiological and behavioral variables. You can see that these major sleep disorders are highly comorbid with a number of health conditions. So I would, as a person who's worked in this area, recommend that the first point of intervention should be in screening for major sleep disorders, because this will reduce the risk of these flow-on effects. A second intervention is to produce rostering systems that minimize the disruption to the circadian clock and minimize fatigue and the health risks. Is how do we empower the worker? We've talked about rostering, we've talked about screening for sleep disorders, we've talked about environmental lighting interventions. What about the actual individual and their part of taking responsibility for their sleep and wake habits? We've worked on an app that is specifically focused on this.
A number of folks with us today who are either in global roles, regional roles, or with corporate headquarters that are in another part of the world. And so we have people who were previously traveling quite a bit and now finding themselves on Zoom calls or Teams calls morning, noon, and night. My question is, how relevant are the findings for our professional workforce and our executives as they are to the shift workers, and also the interventions as well? How might we think about the various interventions in a professional context? And that's to both you and Alex.
Maybe I can start with, there have been a number of research efforts that have looked at the mental health and the sleep impacts of the COVID-19 pandemic and its relationship to work. We've done some work in that area as well. We find a significant increase at a population level in mental health symptoms, as well as sleep disturbance at a population level. When we drill down in the data, we see significant differences between individuals depending on their circumstances. We actually find that for some people, their sleep improved, and for some people, their sleep got worse. And we're looking at factors that predicted that. One of the key factors that predicted it was around flexibility around your work schedules and the kind of work schedules the person was trying to have in place. We also saw that, for example, exposure to daylight was another factor that was predicting poor sleep outcomes, a lack of exposure to natural light. We see a close interaction between sleep and mental health outcomes as well. The second part of, I can refer the readership, the audience to more findings in that area. The second part of your question is, how applicable are these kinds of interventions to that kind of workforce that was, for example, working from home? And I would say highly applicable. The lighting finding is really important, because lighting in whatever environment we're in is critical to maintain synchronization of circadian rhythms, promoting mood and optimal alertness as well. The sleep disorders part has been relevant before the pandemic, during the pandemic, and after, in terms of the fact that we have such high prevalence of sleep disorders. And it's not just shift workers that are at risk of sleep disorders. Insomnia is a highly prevalent sleep disorder that affects people, particularly who are in stressful occupational areas as well. And so we work with a lot of people in corporate areas and so on on problems like insomnia and obstructive sleep apnea that can be undiagnosed and can be having a toll on the person's mental resilience and their ability to function effectively in the workplace.